I don't know that it matters so much the grade of arthritis as why would you choose to use bone marrow over fat or fat over bone marrow to begin with. And part of this boils down to, I think, what's the purpose that we're trying to accomplish? If we're trying to accomplish patients feeling better, or are we trying to accomplish regeneration of cartilage? If you look at bone marrow, what I do in terms of looking at why bone marrow versus fat, first of all, we look at the number of cells in bone marrow versus fat. If you take 1 ml of bone marrow, that contains approximately 6 million total nucleated cells. But of those 6 million total nucleated cells, only 0.001 to 0.01% are mesenchymal stem cells. That turns out to be between 60 and 600 stem cells out of those 6 million stem cells. If you look at 1 gram of adipose, you get 2 million total nucleated cells. But out of those 2 million nucleated cells, approximately 10% are going to be stem cells, which turns out to be 200,000. So for me, it's more an issue of where am I going to get the greatest number of cells? Now, there is some argument that bone marrow has a greater osteogenic potential. But in the case of OA, we're not trying to regenerate bone, we're trying to treat cartilage, or in the case of soft tissue, we're trying to treat soft tissue. So the osteogenic discussion becomes less of an issue. So for me, it's where am I going to get the greatest number of cells? And for me, fat is that situation. Now, younger people do have more stem cells in the bone marrow. The problem is, as we age, the cells in the bone marrow senesce very, very quickly, and the number of stem cells fall off. That doesn't happen in the fat. So you preserve that ratio in the fat much better than you do in bone marrow. So unless somebody doesn't have enough fat, for me, I usually go to the fat for treating most of these OAs and for soft tissue.